You wake up late one morning and are rushing to get yourself together and go to work. You get your clothes on, make the drive to work, and report just in time. That was a close call. As you are going through your day, you begin to notice a not so pleasant smell. After another hour, the smell goes from not so pleasant to rather offensive. It then hits you that the smell is you. You forgot to put on deodorant. This was an isolated incident for you. It is a part of your normal morning routine to put on deodorant right after you take a shower. You take pride in being clean and smelling good on a daily basis. Your personal cleanliness is important not only for you, but also for those around you at home and at work. Let's talk about your cleanliness at work. Nurses are responsible for helping patients enjoy the same sense of pride. Some patients may just need the supplies to take care of themselves, while others may need you to actually help them with their hygiene. Hygiene refers to the steps taken to be clean and prevent the spread of disease. Many different varieties of hygiene agents are available for different parts of the body. We are going to talk about the ones used on the skin and mucous membranes. Our first and hopefully most obvious hygiene agent for the skin is soap. Soap is a cleansing agent that removes dirt and other substances from the surface of the skin. Not all soaps are alike though. When you get to the doctor's office, nursing facility, or hospital where you work, you will be using antimicrobial soap every time you wash your hands. That is soap that kills the different types of microbes and removes them from the skin. This is also sometimes referred to as germicidal soap. The soap you will provide to your resident patients is bathing soap. As the name tells you, this is soap for bathing purposes. These soaps can be used on all surfaces of the body and have the primary function of removing oil and dirt from the body. Our next skin hygiene agent is deodorant. A deodorant is an agent that helps to conceal offensive bodily odors. Deodorant in and of itself doesn't really do anything to clean the body, but it does prevent the release of fumes from the body that could attract disease-carrying or disease-causing organisms. Emollients are another class of skin hygiene agents. You probably refer to these as skin moisturizers since that's what they are. Some different types of emollients are lotions, body oils, creams, and petroleum jelly. Emollients help with our hygiene efforts by making the skin moist and flexible. This helps to prevent cuts and abrasions that may grant microbes access into the body. These are especially important in very dry climates. So let's switch gears and discuss the agents that we use on the mucous membranes. Do you need a refresher on what the mucous membranes are? Let me help you. These are the mucus secreting tissues that line the openings of the body. We are talking about the mouth, nose, vagina, anus, etc. Now that we're all on the same page, let's get those mucous membranes clean. Mouthwash, also called oral rinse, is a liquid for cleaning and rinsing the mouth. The most beneficial mouthwashes are the ones that contain an antiseptic, which is an agent that helps to prevent microbial life. Another agent for the mouth is toothpaste. This is a cleansing paste or gel for the teeth. Toothpaste removes the bacteria that build up on the teeth as we sleep. This is very important since the bacteria that grow in the mouth could potentially cause infections in the gums, bloodstream, or heart. Toothpaste normally contains some amount of antiseptic as well. The nose is usually a self-cleaning type of environment, but there are times when hygiene agents may be needed. The most common nasal hygiene agent is saline solution, which is a solution of water and salt. This can be dropped, sprayed, or flushed into the nose to clean it out. Saline solution keeps the mucous membranes moist, which helps to keep them intact and prevents microbes from crossing the membranes into the body. It also changes the salt concentration, which helps to prevent microbial growth. The outer surface of the mucous membranes of the vagina and anus are cleaned using the bathing soap that we discussed earlier. This usually suffices to keep the membranes clean and prevent infection. There are some instances when special hygiene agents may be needed and used as directed by a physician. This includes douche, anal cleansers, and cleansing enemas. We learned a little about hygiene, which is the steps taken to be clean and prevent the spread of disease. The different hygiene agents for the skin that we discussed include antimicrobial soap, also called germicidal soap, soap that kills the different types of microbes and removes them from the skin, bathing soap, soap for bathing purposes, deodorant, an agent that helps to conceal offensive bodily odors, emollients, skin moisturizers. The mucous membranes are mucus-secreting tissues that line the openings of the body found in the mouth, nose, vagina, and anus. The hygiene agents for the mucous membranes include mouthwash, also called oral rinse, a liquid for cleaning and rinsing the mouth. These normally contain an antiseptic, which is an agent that helps to prevent microbial life. Toothpaste, cleansing paste or gel for the teeth. Saline solution, a solution of water and salt used to clean the nasal cavity.